Hello, good morning. I am Arlina Sol. So I am now presenting to you about the administering of medicine. So as school staff, childcare, or other provider is part of our job. It may involve administering medication to children in your care or in our care. As you are well aware, there are several forms of medications, and each form has its own method of administration. So in administering medicine, we have the 5 rights. So when administering a medicine, it is a good idea to remember the 5 rights to make sure the right child has the dose of the right medication given by the right route at the right time, and this will help reduce the chance of making a mistake. So remember, before giving any medication, wash your hands. If the child will be touching the medication, his or her hands must be washed too. The first right is the right child. So even if you think you know the child you're giving medication, you have to double check by asking his or her name. Checking the name on the medication label. You have to check if there's a label against the permission form. Okay, so like for example, what is your name? You have to ask her name. What's your name?
Brielle.
Brielle? What's your surname? Brielle what?
Brielle Hassel.
Okay, Brielle Hassel. So if you are not familiar with the child or the child is non-verbal, check the child's identity with another staff member or verify the child's identity by having the child's picture stapled to the medication. Sometimes there's a pictures on the medication form. So, and it says that you have to be given to give an antibiotic at 12 o'clock. So make sure you're administering the right medication. Compare the physician's written instructions to the medication log and the pharmacy label. So the third right is the right dose. Always give the right amount of medication specified by the orders from the persons with prescriptive authority and the pharmacy label. So make certain to use a medication spoon, medication syringe like this, or the medication cup like this that came with the medication, so that the medication will be measured accurately. As you can see, there's a certain amount. There's like 15 ml, 10 ml, 5 ml to make it exact. So fourth is the right time. You have to check the medication log for the time when the medication should be given. Check to see if the medicine has already been given for the current day and plan. So the medication will be given up to 30 minutes before or 30 minutes after the scheduled time. So in some cases, you may need to contact the parents to find when the medication was last given at home. Lastly is the fifth right. It is the right route. So this is the method by which the medication is to be taken, whether oral or inhaled or topical. Again, the authorization, medication log, and pharmacy label will tell you the correct route for the medication. If you have any question or if anything is not clear, contact your school nurse, childcare, health consultant, or parents, and always review these 5 rights before you give the medication as you are preparing to give the medication, and finally when you're complete the task including the medication. So these 5 rights give you a systematic way to check what you are doing and reduce your chances of making a mistake. Thank you so much.